What's up, guys? This is Dr. O again. I want to continue our series on medication safety. Today, I want to discuss medication side effects. Okay, hang in there. This is going to be quick. All right, here we go. One of the questions I get a lot in my practice is, Dr. O, what about the medication side effects? Everybody seems to be worried about it, and I'm here to say, I get it, it's real, but hold your horses, let's talk about it, okay? Most medication side effects are simple and usually go away after you stop your medicines, all right? Tons of people will come with complicated blood pressure and diabetes. Instead of worrying about that, they're coming in worrying about what side effect the medicines would have. Like I said, I get it, but let's unpack this a little bit because your blood pressure, your diabetes, or whatever else is going on is likely more important to deal with than worrying so much about medication side effects, especially if you haven't even taken the medicine for the first time. Most medication side effects occur with repeated exposure, but also some occur quite early in treatment. Okay, side effects are usually either dose related, due to allergic reaction, due to what we call anaphylactic reaction. Those are the broad classifications of side effect. Dose related. Most medicines, the higher you go on the dose, the more likely you're going to get side effects. Actually, that's why we started using different classes of lower doses of different classes of medicines to treat your conditions. For instance, blood pressure. There are different classes of blood pressure medicines. Instead of maxing out on the dose of one medicine, typical strategy will be to use a small to medium dose of one before adding a second or a third agent. That way you get the benefits without the side effects that come from high dosages, right? Now, the second one, this could be drug-drug interactions. All right. If you combine this medicine with that medicine, maybe something bad will happen. An example: people that take Coumadin is a blood thinner, and they cannot take aspirin and ibuprofen and naproxen because this makes the blood thinner more potent, and you likely to have bleeding. So that's drug-drug reaction. Oh, by the way, let me back up. I did mention allergic reaction. You will get an allergic reaction after repeated exposure to some medicine. So it doesn't happen immediately you take the medication. The one we cannot predict, we call anaphylactic reaction. That means you take it, you didn't know that you were going to react adversely to it, and something bad happens. In anaphylaxis, a good example, if you get bit by a wasp or stung by a bee, people can have anaphylactic reaction. That's where they can't breathe, their throat swells up, and they have to go to the emergency room, or sometimes, unfortunately, people die from that. So those are, we call them idiosyncratic reactions, where we couldn't predict that would happen, and yet it did. But those side effects are very minimal. Majority of side effects are simple side effects that resolve after you stop taking the medicine. So it is way more important to me that you come in and let's talk about what side effects you may have experienced so that we can deal with it, because most of them are easy to deal with. The other thing that happens is, because people come in already afraid of a side effect, as soon as they take a medication, they will swear that they've had side effects to the medicines, and therefore they stop taking the medicines, almost as if they were looking for an excuse not to take medications. These are very common, and these are seen quite regularly. Most medication side effects are GI upset, right? I feel queasy in my stomach, I feel like I'm going to throw up, or something to that effect. I have a headache, I have drowsiness, I have body aches and pains. People that take statins for cholesterol will be familiar with body aches and pains from statins. It happens sometimes, not a lot, but as soon as you stop the medication, it goes away. These are the more common side effects. The more serious ones, like the allergic reactions and the idiosyncratic reactions, fortunately are not nearly as common. And when we see those, we flag you to be allergic, for instance, to penicillin or something like that, where you don't get those ever again. So the reason for this is, I don't want the fear of side effects to stop us from taking medicines that could potentially save our lives. can't tell you how many times patients come in, blood pressure is through the roof, and yet they're asking me, what about the side effect of this medicine that they haven't even taken one dose yet? So that is not very reasonable. It's always important to communicate with your doctor. Let's figure out whatever it is you're experiencing. Is that really a side effect or is that something else? So it's not all bad news. Let me give you some funny examples of good medication side effects. Back in the day, a prostate medication called finasteride was developed for enlarged prostate. Well, guess what happened? We found that some people were growing hair on finasteride. So guess what we did? Guess what pharmaceutical companies did? They repackaged finasteride, called it Propecia, and now we use it for hair loss. Another medication, minoxidil, developed for blood pressure, same thing. We found that it made people grow hair, especially women when they didn't want to grow hair. So they repackaged it, made a paste of it, now you put it on your hair when you're growing bald. Now, do you want to know the Mac Daddy of all medication side effects? This is the big one. Back in the 80s, doctors were investigating a new compound for a deadly condition called pulmonary hypertension. We didn't have any treatment for pulmonary hypertension, and by and large, people died from it. So they developed a new compound, and they were trying it on the clinical trials was based on elderly men and women, but men who basically had no other choices and no other options. And guess what happened months into the research? Their spouses came in and told the doctors, hey, whatever you're giving him, please continue to give him because, his member has started waking up. Guess what we did? They repackaged that medicine, called it Viagra, and we sold it over the world. It became a blockbuster product for Pfizer, right? It was only many years later that they went back to the study, now produce the generic called sildenafil for pulmonary hypertension. So not all side effect is bad for you. Some side effect we take advantage of to treat other things. I just gave a few highlights, but there are lots of those available. This is to encourage you, don't let the fear of side effects stop you from taking your medicines. Please speak with your doctor who understands you, who can explain to you better. Don't go based on word on the street, what Cousin Joe did and what Auntie May did, okay? This is Dr. O with the Minority Health Report. I hope this is helpful. Please like us, please subscribe, please check back regularly so we can continue this conversation. Good, reliable health information is important for our well-being so we don't get confused by a word on the street. Take care. Until next time. Bye now.